According to UNICEF, vaccines save an estimated 2 to 3 million lives around the globe every year. They are essential to human survival. They treat highly infectious diseases, many of which can be fatal. Left untreated, these diseases, such as measles, spread rapidly, infecting the masses, causing epidemics and killing many. Many parents have concerns over immunizing their children, but as a mother, I am a firm believer that all children should be vaccinated to not only save their lives, but the lives of countless others. While their concerns are valid, many don't understand truly what vaccines are, how they work, or what diseases they fight against. They also don't know that the myths about vaccine, like that they cause autism, have been proven to be false. Nicola P. Klein, the director of the Kaiser Permanente Vaccine Study Center and a senior research scientist at the Kaiser Permanente Northern California Division of Research, explains that vaccines contain a low number of antigens, the parts of germs that cause the body's immune system to respond, and this tiny exposure helps the body recognize the disease and fight it off. So in other words, a vaccine comes into your body like a little army defending a castle or your body. Some of the enemy infantry may get past, but not nearly enough to do any serious or lasting damage, and certainly not enough to capture your castle. That is why when you get certain vaccines like the flu shot, you may still get sick, but not nearly as sick as you would be without it, and definitely not sick enough to be fatal. Vaccines are actually a dual defense mechanism though. Not only do they protect your body, they protect everyone around you, since every disease they prevent against is highly contagious and potentially deadly. Therefore, you are not only protecting yourself against these diseases, but you are also protecting your loved ones and everyone you come in contact from also contracting these diseases and possibly dying or being left with some serious long-term complications. Additionally, vaccines are responsible for disease eradication, which helps protect future generations. Smallpox is the only disease to have officially been fully eradicated from the earth. It was once one of the most feared diseases the world over. According to medicine.net, approximately 1/3 of the people who contracted smallpox died from the disease. Thanks to vaccines, though, the last naturally occurring case of smallpox was in Somalia in 1977, and then in 1980, the World Health Organization and the World Health Assembly certified that the world was finally free of smallpox. Campaigns are now underway to try to eliminate other diseases, such as polio and the measles. Polio is the closest, being over 99% eradicated today. According to vaccines.gov, polio was once America's most feared disease, causing death and paralysis across the country. But today, thanks to vaccination, there are no reports of polio in the United States. So exactly which diseases do modern vaccines protect against? According to kidshealth.com, on the list of immunizations children must get is the MMR vaccine, which fights the measles, mumps, and rubella diseases. Parents.com states that in the winter of 2015, when 147 cases of measles spread into 7 states, plus Canada and Mexico, parents were unnerved, partly because the outbreak started in Disneyland in California. But it could have been so much worse. If there were no measles vaccine, we'd have at least 4 million cases in the US every year alone. Before the vaccine arrived in 1963, nearly everyone got the disease in childhood, and on average, 440 kids died from it annually in the decade prior. The varicella vaccine is next, which protects against chickenpox. Approximately 100 deaths and 7,000 hospitalizations from chickenpox are reported every year just in the United States. Another important vaccine is the DTaP, or diphtheria, tetanus, and pertussis vaccine. According to healthychildren.org, this prevents whooping cough, lockjaw, and diphtheria, a disease which causes a thick covering in the back of the throat. This can lead to breathing problems, paralysis, heart failure, and even death. Then we have the hepatitis A and B vaccines, which prevent HBV infections that cause liver disease and liver cancer. The HPV vaccine, which protects against the human papillomavirus, which is a sexually transmitted disease with at least 79 million people estimated to be currently infected, and approximately 14 million new cases occurring in the US alone each year. Is another incredibly important vaccine to get because HPV causes genital warts, infertility, and cervical cancer. On the list is also the rotavirus vaccine, which protects against the rotavirus, which causes severe diarrhea, vomiting, and fever, leading to rapid dehydration. Rotavirus is responsible for the deaths of an estimated 600,000 children worldwide every year. Last but not least is the meningococcal vaccine, which protects against the meningococcal disease, a severe type of flu, leading to death in 10 to 15% of cases. Among those who survive, as many as 19% live with permanent disabilities, such as brain damage, hearing loss, loss of kidney function, or limb amputations, according to the National Meningitis Association. Despite knowing how they work and what diseases they prevent, many parents still have fears about vaccines. One common fear is that the rise of the number of vaccines from 50 years ago to today, 14 to be exact, that children get by their second birthdays, that it will overload their tiny systems. This is actually not the case, though. A lot of scientific study from a panel of medical and public health experts goes into the recommended vaccine schedule. When children are born, their immune systems are just beginning, so it is important to vaccinate as early as possible to prevent any chance of infection. It also, in turn, builds up their immune systems, actually making them stronger since they are still growing. Many parents ask if vaccines are really safe, and the answer is yes. Vaccines are completely safe and are only given after extensive research. In fact, they are one of the most extensively tested medicinal products on the market today, even more so than nutritional supplements. According to Verywell Health, if at any point the risks of the vaccine start to outweigh the benefits, health officials sound the alarm and the vaccine is pulled. Another large concern is that vaccines contain toxins such as mercury, aluminum, and formaldehyde. They may sound scary, but these ingredients are in fact safe. The Marisol is the mercury-containing ingredient that used to be in most vaccines, but is currently only in the flu and tetanus shots. Also, the mercury thimerosal is ethyl mercury, not methyl mercury, the toxic substance found in tuna. Ethyl mercury is processed much more quickly by the body. Aluminum salts are sometimes added to vaccines to help make them more effective at boosting immunity. They've been included in vaccines for more than 70 years and have a strong safety track record. In fact, breast milk and formula has more aluminum than vaccines do. Formaldehyde is sometimes used to actually remove toxins in vaccines in the manufacturing process. Almost all of it is removed before packaging, though, and only trace amounts ever remain. All of these ingredients are added in such small amounts that they are processed by the body very quickly and pose little to no risks. Perhaps the biggest and scariest fear to surround vaccines is that they cause autism. This is a myth that has been debunked. It started in 1997 when a team of British surgeons published an article in the prestigious medical journal called The Lancet. The article examined 12 children who had intestinal issues, developmental conditions like autism, and in most cases had received the MMR vaccine. The authors wrote in the paper, and I quote, "did not prove an association between measles, mumps, and rubella vaccine and the syndrome described." However, the lead author, Andrew Wakefield, went public with the information claiming it to be the opposite. The Lancet quickly retracted the article and Wakefield was stripped of his medical license. The claims turned out to be falsified and biased, but it spread so quickly like wildfire. Many other scientists and medical professionals have since examined the cause of autism and its correlation with vaccines and found no supporting evidences to link them together. There is in fact no proven causes of autism. The evidence is there to prove that vaccines are not only safe but necessary. They are vigorously regulated by medical and public health experts. Any unsavory ingredients are found in such minuscule amounts that they are basically irrelevant and they definitely do not cause autism. They protect against diseases which are highly contagious and, if contracted, can lead to death and lifelong complications. When you vaccinate your children, you are not only protecting them, but everyone around them and future generations to come through disease eradication. We've already eradicated smallpox and are on our way to eradicating polio. If all kids were required to be vaccinated, how many other diseases could we eradicate? How many lives can we save? The huge benefits way outweigh the small amount of discomfort your child will face being vaccinated. So if you haven't already, go vaccinate your kids.